Hello, hello. My name is Dr. Alessandro Frias. I'm radiologist. I'm the admin of the web virtual radiology clinic. You can find my web in the address www.dralessosarrat.com. In this web, you can find some diseases explanation, some organ explanation, and interesting cases maybe related with some diseases like and the proposal of this is just to explain and educate the patient regarding diseases to better understand it. The day of today, in this short video, I want to explain something about one important organ named gallbladder. Gallbladder is a pear-shaped organ located below the liver in the inferior surface. It's an empty organ, it's muscular membranous, and the function of this organ is just to collect bile during the fasting period, and also concentrate this fluid, this bile, and pour this content on the food when during the digestion process. Some relation of this organ, for example, you can see here that the ducts that conduct the fluid to the gallbladder is common hepatic duct. From this place, the bile is coming and go into the gallbladder, that is empty organ, like I told you before. And as you can see, have a wall. I will explain later the layer of the wall. And the bile is coming from the liver, going inside the gallbladder, collect them during the fasting time, and accumulate there. Also concentrate. When you eat something, for example, this is the stomach. You eat something. After the stomach, the food go to the duodenum, and here in this place, the gallbladder started contracting using some structure from the wall and poured some fluid named bile. This bile is have some substance that help you to digest protein and fat. And also you can see the relation here with the pancreas. Here is some part of the gallbladder. As you can see, how gallbladder have a neck. It's really important to understand what some disease coming. The body is the biggest part, and the fundus. As you can see, here is empty. We remove one part of the wall, and this here is the dog where the bile contained came from the liver. Here is a common bile duct, just to send to transit or to send the contained to the duodenum. Here is a draw to understand what is the wall as empty organ have a wall. The gallbladder as an organ have a wall. This wall is formed for four layer. The internal layer is the mucosa. You can see here. This mucosa, what is the function of mucosa? Mucosa just absorb fluid to make more concentrated this content, because this is a reservoirium and collect bile from the liver. Then when during the fasting period is taking or receiving the bile from the liver, receiving the organ, because it's like a sac, is increase the volume, and this layer just reabsorb the water and may concentrate the bile. This is very important to know. Then you will understand why during the fasting process maybe any person, any patient will concentrate too much the bile, and will appear some small issue that I will in future videos I will explain. The next layer is the lamina propria. Lamina propria is like a wall that just make to get join the mucosa and the musculary layer. The next layer is a musculary. What is the function of musculary? Like a muscle, just contract the organ during the eating process. When you eat something, mainly a fat or protein, But this muscle starts to contract the organ like a container. Imagine that you will pour some sauce on any, for example, any bread or any meat or anything like that. The muscle just contract the organ and just send the bill through the ducts and pour on the inside the duodenum on the food and help you to digest the fat, important, the fat and the protein. For this reason, when any patient have problem in the gallbladder, will feel some discomfort when eat, for example, KFC or some heavy food like meat, something like that. The next layer and very important layer, as you can see here in the draw, only cover the gallbladder in the inferior surface. This is the peritoneum. What the peritoneum is? Peritoneum is a layer. It's like a skin covering the internal surface of the organ. Why is important this relation? Because sometimes when the gallbladder is inflamed for something, any inflammation coming from the obstruction or or just infection from secondary infection, then the peritoneum, this peritoneum become inflamed and just make one disease or become inflamed and just create one disease named peritonitis. This peritonitis is very dangerous and is cause of acute surgery. Then this is the images because I'm radiologist, of course. Then this is the images that we can see when we do one ultrasound. This is the gallbladder with the wall here and this fluid contained. And this is the liver because it's located below the liver surface. And then just to remember the most important point of this organ, because this is the first video from gallbladder. After this video, I will explain some diseases, but it's very important that you understand what is the anatomy of the liver. Remember, the gallbladder. Remember, gallbladder is the empty, is like sac organ, pear shape, located below the liver surface here in the right side, upper right side. Then sometimes patient coming with the disease inflammation in the gallbladder, and it's coming with just holding this place. Is located in the below the or attached to the inferior surface of liver. Is empty, has a wall. This wall have 4 layers with a specific function, and it's important the function. The internal layer is a mucous. This mucous layer just concentrate the bile and just remove the water from the bile to make more concentrate the lamina propria. This layer just put together the internal mucous and external musculary layer. The muscular layer also very important because it's the one of the function of the gallbladder is what is just to pour will contain in the here in the duodenum, as you can see here. You see this is the organ muscularly start to contracting during the eating process. When you swallow something like a KFC, like a meat, like something any, then the musculary propria, the musculary layer start contracting the organ to pour fluid through this duct to the duodenum. And just why? Because this will help you to digest the food, mainly the fat food and protein. Okay, and the last layer and very important is the peritoneal layer. Peritoneal layer just cover the organ in the inferior surface, and it's very important because the peritoneal layer just is it's like the skin covering the abdominal cavity, the internal surface of abdominal cavity. Then if there is any inflammation here or any tumor, also because tumor infiltrate, just attack also the near organ. And here, for example, inflammation here, just share the inflammation to to the peritoneum and just justify the symptom that this patient will feel when any inflammatory disease from the gallbladder will appear. Okay, then remember, locate in the inferior surface of the liver. It's a sac. The wall is formed for four layers: mucosa, lamina propria, muscularis, and peritoneal. Okay, the function is just like as a reservoir of the bile. The bile is the fluid coming from the liver and help you to digest the mainly the fat and the protein. Okay, and is collecting this fluid during the breakfast and period and start to contracting and pour this fluid to the duodenum during the eating time. Okay, then just this is the video that I want to show you before. Just if you like this video, just click like. If not, just dislike. Also, if you want to share or if you want to listen or see more content or more videos like this, just register in my channel. I will share in English and also in Spanish some of this video because I have patients both both languages. Thank you so much to attend this video. Remember, try to be happy all the time. Just see you next video. Okay, thank you so much. See you.